we know now that disparities exist throughout this country when it comes to health and health outcomes. And what, is at the forefront is that disparities exist along racial and ethnic lines, but they expand beyond that. They can exist in areas of geography. Socioeconomic status is very, very important. And as we've already mentioned, race and ethnicity also are important when it comes to disparities in health. The Health Center brings health access to the Lonsdale community. It helps engender trust between the providers in that health clinic and the people of Lonsdale because they develop relationships with those folks. Trust traditionally in underrepresented neighborhoods has not existed in this country for a lot of different reasons. And so it addresses both of those barriers. But bigger than that, the Haslam-Sansom complex, the sports fields, address some of the other issues that we're talking about. And it also builds or demonstrates a culture of wellness. When you see kids coming together to play, it makes that right. It makes it okay. It gets them involved in sports they're not traditionally involved in. And it starts to create a culture of wellness within that home because the parents now see the kids exercising and they have a better body self-image and they have better weight control and they prevent these chronic diseases from developing, and they may adopt those habits. I think sports does a couple of things. It provides a safe place for kids to exercise. It makes it okay. It mitigates the development of chronic disease. It creates a culture of wellness going forward. For example, I exercise because I saw my dad exercise every day growing up. I participate in sports because my parents did. My kids are all athletic and participate in sports because my wife and I did growing up. And so we propagate that culture in our home. And we don't have, at least in the last 2 generations, we're not dealing with chronic disease, and we have to set that example. And I think Emerald Youth has done a good job of that in our community. What I do now, in my role as chief medical officer, I develop teams, I lead teams, I moderate teams, team conflict, but I learned that playing basketball and playing baseball and running track, not in a classroom. So I think it bodes well for the community at large, what Emerald's doing in the community related to sports.